So now we are going to talk about routing patients to chiropractic rooms. So the person here in the front desk 2 spot is responsible for keeping patients in the proper order and shifting cards from the medical to chiropractic side as needed. And so basically we have these 2 folders up in place for privacy so that other patients walking by can't see another patient's name. And what you'll notice is that, for one thing, we have paper clips here, and so this is in the order that patients arrive, or typically in the order that they're seen. Having said that, there are some instances in which if one patient's coming for a massage and 4 other services, even if they got here before patient number 2, who's just getting adjusted, obviously patient number 2 would end up leaving first, so this isn't always necessarily the order they come is not necessarily the order that they're seen. Or some patients might come and see the medical department before chiropractic. But typically front desk 2 controls the flow entirely, so we don't really question the order they put in the cards. Unless we think that they may have made a mistake or forgotten about somebody, that would be a good instance just to double check. But what we don't ever create is a situation where we're arguing with them about the order to take patients, because that's kind of their department. Now, sometimes cards are actually facing backwards. When cards are facing this direction, it means that a patient is either in a massage or that they may be on the decompression table. And so then when the patient's done, they'd be put back in order. So when the cards are facing this way with the routing slips on this side, these are patients who are here for treatment and they're basically ready to go. Now, where do we find these patients? Sometimes they should ideally only be in one of 2 areas. If they're being seen by the medical provider, their card's going to be gone, so they won't be here. If they're here, they're ready to go, so they're either going to be in one of our massage therapy chairs over here, or they're going to be over here, in the therapy room. Now, the important thing is that we do not want to ever just blatantly interrupt the beginning of a patient's therapy. So a lot of patients will get very aggravated if they sit in the chair and they just get back and comfortable, and 3 minutes into it, someone's telling them to get out. You know, that's not very efficient, and it can be aggravating to some people. Having said that, if a patient explains to us that they are in a hurry, but we need to buy a little time, or they want to sit there while they're waiting, that would be an instance in which we would let them know maybe 2 or 3 minutes and that we have a room ready. So it's just kind of using your best judgment, but we try to at least give them 10 minutes solid in the chair unless they request otherwise. Or unless it's going to cause a major disruption, like the doctor's going to be tied up for an hour seeing 2 new patients if we don't see them first. So there are special circumstances, but in general. The same thing goes with the therapy room. A lot of times patients will do a circle of like 5 different therapies. We can take them between therapies, but we really don't ever want to interrupt them mid-set. So if they just get their head weights on and they just get on the vibration plate and they're in the middle of a 10 or 15 minute treatment, we don't want to interrupt that. So if there is a separate therapy tech, the chiropractic assistant and the therapy tech communicate, because on your way past, you might let the therapy tech know who you'll be taking next, and then basically when Mr. Jones is done with his neck traction, she would not allow him to proceed to the next exercise, or say, well, you can sit and kind of get loosened up on the wobble chair, but you're going to see the doctor next, so be ready. So that's kind of how it works. But if we don't have a dedicated therapy technician, then the CA just has to use their judgment about, and we can also communicate to patients to let them know when they're up next. Patients like that as well. But essentially, the only other thing that is really imperative, we are not a regular medical clinic that people go to once every 6 months for checkups. People a lot of times are here 3 times a week. So being courteous of their time and as efficient as possible while still maintaining a high level of care is of extreme importance. So whereas some people are kind of laid back about a patient waiting 5 or 10 minutes, my perspective is that there are some cases in which it's absolutely unavoidable. But if it is unavoidable, but if we can avoid it by any means, we need to. So I don't like to ever see a patient waiting needlessly. Sometimes it's tempting for staff members to catch up on an administrative task or finish a chart note or grab something that's on their checklist so they can get out earlier, and they'll just leave a patient waiting 5 or 10 extra minutes. It might not seem like a big deal, like I said, but when a patient's here 3 times a week and they're waiting 10 extra minutes each time, and they see the staff members there, they see rooms open, patients notice these things, and they will quickly realize that you've wasted a half an hour of their life when they could be with their family doing something else. So for that reason, when I'm seeing patients, even if I'm in my office doing something, I want to be interrupted if a patient's waiting. Patients always come first, and especially patients that are new patients or kind of interviewing us. All patients come first, but especially those that are new. So basically, when a patient, so the chiropractic assistant has to make sure that during our treatment hours, that he or she is always really cognizant of when patients are coming in, and it's, can be aggravating for the front office staff when patients come in to go have to find the chiropractic assistant. So it's good just to always stay up in this area and be on hand to assist patients. But you're going to pull from this direction, so this first card in the front will be the first person, and the patient's name is going to be here listed last name first and then first name second, which is important. Sometimes people have first and last names that could be a first name, and so it's kind of embarrassing if you are talking to Paul Ryan and you're looking Ryan, and his name is Paul. You follow me? So make sure you always look at the first name. The other thing to mention is that because this is an open area, we have to be very cognizant of patient privacy, and HIPAA is law that we're all familiar with, but there are extreme fines and big consequences if we violate a patient's privacy, which means that we can use their first name, we can refer them as their last name, but it's not acceptable to be saying Paul Smith or a patient's full name, or to be talking about any of their health information or any personal information, basically. So it's best to always not talk in a big distance, but to go over the patient and speak to them personally. So we grabbed the card. Prior to this, we would have made sure that our rooms are set up ready, clean, and all ready for patients. And so basically, we would just find the patient that we're looking for and let them know that we'll be taking them to the room. It's real important that if a chiropractic assistant is new, a lot of times patients feel very uncomfortable around someone they don't know or someone they haven't been introduced to. We don't really have necessarily another staff member to make every introduction, so we definitely want new staff members to be very friendly and introduce themselves, and make the patient feel welcome, and something along the lines of, "Hi, my name is Renee. I'm going to be helping you to the chiropractic room. I'm a chiropractic assistant here. Please come with me." That sort of thing. But we always want to be extremely courteous and very nice. Definitely smile at the patient and kind of walk at their pace. And so just kind of like some elderly people move very slow, and if you're running ahead and not even, that can appear rude. Sometimes patients need assistance walking, so we want to keep things as efficient and quick as possible, but also while maintaining a good level of customer service for the patient. So basically, then you're going to find the patient where they are, and then you're going to escort them to the chiropractic room. And there you can pause it if you want, or stop it actually. You can stop there.